Good afternoon, everyone. Welcome back to my channel if you've been here before, and welcome to my channel if this is your first time visiting. So today I'm going to talk about making the switch from an antipsychotic medication to Cobenfy. Now, for those of you who are not familiar with Cobenfy, it is a schizophrenia medication that was approved in 2024. Cobenfy is not an antipsychotic medication. I have seen people talking about Cobenfy on their podcast, and they're calling it a antipsychotic medication, but they're not doing their research because it's not an antipsychotic. It works differently than an antipsychotic medication, and it reportedly does not cause the devastating side effects that antipsychotic medications can cause. Now, if you're thinking about making that switch, here's some things you might want to consider or know about, rather. So, first of all, your doctor will have to determine if you are stable enough to make that transition. That's part one. And then also, the doctor will have to evaluate you to make sure your liver, kidney, and heart are functioning properly. If the doctor deems that you are fit enough to make this transition, then what's going to happen next? There's a transition process, and that process will depend on what type of antipsychotic medication you're taking. Are you taking an oral medication such as Abilify or Risperidone, or are you taking a long-acting injectable such as certain types of Invega? And it also matters whether or not you're taking something like clozapine, because my understanding is that clozapine is used as a last resort to treat those people who their schizophrenia symptoms have been resistant to other forms of medication. And I've heard that there are good results from that medication as well. So if you're taking an oral medication and it has been decided that it's okay for you to make the switch to Cobenfy, the doctor will first introduce a low dose of Cobenfy and then begin to decrease your antipsychotic medication over a period of 1 to 4 weeks. That's what the doctor will keep doing, gradually decreasing the antipsychotic over time and gradually increasing the Cobenfy. While this is going on, you will be closely monitored by your doctor. While this is going on, I highly encourage you to advocate for yourself or for your loved one. Don't be afraid to ask questions. Some of the questions you might want to ask include, right off the bat, asking the doctor, how fast are you going to taper me off the antipsychotic medication? You should also ask, what symptoms should I be looking for? You also might want to ask, how long will it take for the Cobenfy to kick in? How will I know for sure that the Cobenfy is working? And you might also want to ask your doctor, what should I do if my symptoms should worsen during this time period? So that's what's going to happen if you're taking an oral antipsychotic medication. If you are taking an injectable like Invega, what your doctor should do is wait until the end of the time period, when it's close to the time period for the Invega to wear off. So Invega comes in a dose that lasts 30 days. There are doses that last 6 months. So your doctor will have to wait till it's close to that time period when that medication is beginning to work its way out of your system, but there will not be a gap. So that medication is not going to completely work itself out of your system. But when it has almost worked itself out of your system, at that point, the doctor will introduce a low dosage of Cobenfy, and then gradually over the next few weeks start increasing your dosage of Cobenfy, which is an oral medication. You will be increasing that dosage over time. If I'm not mistaken, you will take Cobenfy twice a day once you have settled into using that medication. So that's how that transition will happen. You will slowly increase Cobenfy over time once your dose of Invega has neared its end. And then there's also things to consider if you are a person that really relapses quick, if there's any kind of gap in your medication. Some people may not relapse and become, into a state of psychosis right away, but some people do relapse and go into psychosis quick. So all of that stuff matters. So if you are a person who has made this transition from an antipsychotic to Cobenfy, I would really appreciate it if you would comment about how this transition looked for you. Was it smooth? And also, how is Cobenfy working out for you? I hope this information has been helpful to you all. And in the meantime, take care, and I will see you in the next video.